Hi, my name's Haley Honeyman. I work at LMH Health as an X-ray tech. I work closely with a lot of different individuals. I work through the ER, through inpatients, through outpatients. We use live X-ray, we use flat plain films. We work closely with trauma patients, work with surgery patients. We see the simplest to some of the more complicated stuff, and that's what I like. We get to go upstairs. We're part of all over the hospital. In surgery, we run machines over there, so we're all over the place. Get to see a little bit of everything. I started out as a CNA, going into healthcare, worked home health and in a long-term care facility. I applied for Washburn using a high school diploma with a little bit of healthcare background. Got accepted into the program. It's a 2-year program. I did my clinicals here at LMH and worked in the imaging support specialist in the front office. Then I stepped up as a student tech in the X-ray department and fell into a tech position full-time. I've always thought that shadowing is a great avenue to go in healthcare. It's hard to see, of course you can talk to somebody and kind of get an overall standpoint of how things work, but going in you can actually see, wow, they're really running around, or they don't really do much at all. I thought it was going to be more than that. So you can see the different aspects of the hospital they're going into. Shadowing can really, even just 4 hours, it doesn't seem that long, but you can see a lot of different things in 4 hours.
My name is Andrew Schenk, and I am a CT technologist. A CT is essentially a fancy X-ray. It uses the exact same type of energy as when you get a chest X-ray or an X-ray of your hand or whatever. The energy and the science is exactly the same. A CT scan CT scan uses higher doses of radiation and is a longer exposure time to allow for a more detailed image of the anatomy. If it has blood flow, we can CT it. From head to toe, we can do it all. So I think CT really allows some creativity. There's no wrong way to get to the end product as far as the image, whether it's an X-ray or CT. You can kind of do the same thing multiple different ways, however you like to do it best. Or as the situation requires you to get it done, whether it's patient condition or pathology that you're trying to, image. There's no wrong way to do it as long as at the end of it, your images look the way the radiologist wants to see them. Patients can be great, patients can be difficult. You kind of run everywhere in between. But I've found the quicker that you're able to make a connection with a patient, the easier it is for me to get my job done. If somebody is seeing me, they're probably not having a very good day. If I can make the 5 or 10, 15 minutes, whatever I happen to see that patient, if I can make that time of their day better, then I've done what I can do.
My name is Taylor Ketron. I'm an MRI technologist at LMH Health. I work just primarily in MRI imaging. Just me and one other tech. It's a very small image modality. We don't work with many people. We scan ER patients, inpatients, outpatients daily, whether it's for like soft tissue, anything like that, using a magnetic field. So you have to start with a 2-year program for radiologic technologists, so X-ray, and then you kind of have a basis of if you want to specialize, you can. You just have to start with that 2-year. X-ray wasn't exactly what I thought it would be. It's very fast-paced, and I just knew I wanted something a little bit slower, but still, on my feet with people. I like the fact that there's no radiation involved, and it's magnets, so I really just chose MRI because I liked that, and then also the pictures itself, it's very detailed. So as far as you really see inside the body, and it's just pretty cool to see. So I feel pretty lucky in the fact that I'll always have a job. I don't see this going anywhere. So I feel as far as demand-wise, I'll always be needed. The pay is very nice. There's always something new to see. And like I said, since it's so detailed inside the anatomy, nobody's the same, so you're kind of like figuring things out. So if you're, like I said, a curious person, definitely look forward into it.
My name's Judd Batchelor. I'm a nuclear medicine tech at LMH Health. In nuclear med, we study the physiology of a patient's organs. So instead of looking at just the structure, anatomy of a patient or the organs, we look at the function of all those organs. So we're not seeing necessarily a beautiful picture of a skeleton or a beautiful picture of a heart. We're looking at the function of that heart, how well it's beating. The bones, we're looking at the blood flow to the bones to see if there's increased blood flow to certain areas, which could be indicative of the bone trying to heal itself in some way. Every job you have has its same routines, but I think in healthcare especially, you see every kind of patient out there, from little toddlers all the way up to centenarians, and so you experience all kinds of backgrounds, cultures. It's pretty cool, and then the technology is just advancing so fast, so rapidly in healthcare that it's pretty neat what's coming down the pipe for nuclear medicine, but also for CT and ultrasound and MR and diagnostic. It's pretty amazing. That'd be my biggest advice. Don't look at just one field. Don't think if you're interested in X-ray, look at X-ray, go follow somebody around in X-ray, go talk to a radiologist, one of the doctors that read those studies. But then also look at ultrasound or go look at MRI. And so that'd be my biggest advice, is actually come in and see what we do and kind of follow us around, and then look at multiple modalities.
A lot of radiology is the techs, they prep everything, do all the positioning and everything, and then set the machine up, and then the machine does the scan. The patient's out the door. And with ultrasound, we have our machines, but our arms and brains are essentially the machine, because we have to try to figure things out, find things. If I don't see a mass on somebody's liver and they haven't had any other imaging, then the doctor doesn't see it, and then the patient they don't know that they have a mass in liver. So I feel like there's a lot of responsibility, and I like trying to figure things out. So that's the main thing I like about it. But it's a little easier to get into programs now. There's more programs out there. If you, like people straight out of high school can get in now with no background, they do like to see that you have observed. So most hospitals will let new students, high school students, observe for 4 hours a day here and there, or maybe an anatomy and physiology class, things like that, and then you just apply to a program. Some people do really good in school and they get out in clinicals and they just don't have that, and it happens. And some people who don't do quite as good in school are great sonographers because they have that hand-eye coordination. It takes a lot of that to kind of know what you're doing. So yeah, don't have to get straight A's. If you can scan, that's the important thing. I think the best thing to do is shadow. We do it here at LMH, but most places you contact the HR department and they can set you up to shadow ultrasound. Most of the time they'll do it like 4 hours at a time, but I think that's the best way, because not only does it do programs like to see that you've done that if you do apply, but it also gets you kind of you can follow us around, watch us scan patients, see what we do, and see if that's something that you're interested in or not. Because MRI, CT, ultrasound, nuke med, they're all really good fields, and each is just a little bit different. So, but I think shadowing's the best way to go.